Rugby is a fantastic sport. Its popularity in the US is growing rapidly, but due to its relative infancy, many practitioners are largely unaware of it. So my aim today is to give you a very brief overview of the rules, the game, and some of the more serious and unique injuries associated with it, specifically those of the cervical spine. That are actually more common in the US game than elsewhere. So rugby in the USA is governed by USA Rugby. They're a professional body formed in 1975. There's over 60,000 members in over 30 local area unions. In Florida alone, there are 15 men's teams and over 9 college teams. So the rules of the game, very briefly, it's an 80-minute game divided into 2 halves, 15 players on each side. All players participate in offense and defense. It's played with a spherical ball, pictured here, on roughly an 80-meter pitch with the H-shaped posts at either end with the tri-zone pictured here. This is Twickenham, England, which is the home of international rugby. You can see the tri-zones here, H-posts at either end. So the aim of the game essentially is to score more points than the opposition. You can do this by scoring tries, which is equivalent to a touchdown. They're worth 5 points. You get a chance at a conversion afterwards, which is worth 2 points, which is similar to the extra points in football, and then penalty kicks, which are similar to the field goals in American football. So in offense, the idea is to advance the ball to the opposition's tri-zone area. You can do this by running the ball directly. You're allowed to pass it in a backward direction only. You can kick forward to gain field position, and then you're allowed to retrieve your own kick. All players must be behind you at the same time. You can't kick to a player who's advanced beyond you. In defense, the idea is to stop advancements of the ball. You can do this by tackling the player. That ball, then the tackled man must release the ball when he hits the floor, and then both teams can compete for that ball. If they're competing for a ball that's on the ground, it's called a ruck. If they're competing for a ball that's in the opposition player's hand, it's called a maul. Or you can try and force the player out of bounds, so you can try and regain possession. If you steal that ball, you can transition straight into offense. So the main differences from American football, which I assume most of you are familiar with, is there's no blocking. You can't contact non-possession players. There's no downs. Play is continuous apart from for infringements. There's no separate offensive and defensive players. And you can transition straight into offense if the ball is retrieved. Fumbles and out of bounds stops play and transfers the ball via the scrum or the line out. Substitutions are permanent, and there's no pads or helmets. So there's 15 players on each side. These are divided into the forwards and the backs. The forwards are numbered 1 to 8. These are the big brawling guys, equivalent to your linemen. They're involved in all the close quarter play. This is the typical forward, big, round kind of guy. And then this is your typical back. There's a number 9 to 15, very skillful, athletic runners. So these are just some phases of play. This is the kickoff. This is what we call a half volley, a drop kick. The ball is kicked into the opposition's half. They can catch it, and then a ruck is set up. The man is tackled, he falls to the ground, he releases the ball, and then the players try and kick out of their own half, and the ball is chased away. So the scrum, this is a very particular part of the game. It's essentially the equivalent to your line of scrimmage. All 8 forwards bind together to form a pyramid and push against the other side as the ball is delivered in between them. This is very particular forward. It's kind of their mating dance. It's a very fierce competition and demonstration of their power. But unfortunately, it's where most injuries occur. This is a picture of the formation. And here we see a quick bird's eye view of a scrum. Both teams lining up against each other and then impacting each other as the ball is delivered. As you see, this scrum collapses, which we'll get to later. So the line out. This is awarded when the ball goes out of play. Forwards line up side by side, and the ball is delivered in between them. And here we see a maul. The player is in possession of the ball, but the other team are trying to steal it. And a maul is set up. So no man's land, this is what I referred to before, the rucks and the maul. Again, it always looks a bit organised when you're watching it, and lots of injuries occur in these positions as men are lying on the floor and there's boots and fists flying everywhere. This is an example of the drop goal. You can kick this from any point in the field. It's got to be a half volley though, and if it goes between those posts, you're rewarded 3 points. This is an example of a conversion. This is after a try is scored. This is worth 2 points. This one is unfortunately missed. And this is an example of how a try is scored. This was actually the winning try in England's 2003 World Cup victory. Here we see the man's tackled. He must release the ball. The other players clear the other men out over it. The ball is passed down the line. And then Jason Robinson runs in and scores. So that's how you score a try. So the attire, this is the old-fashioned kit, just cotton jersey, cotton trousers. Now it hasn't really changed much. In terms of protective gear, there really isn't much you're allowed. You're allowed a thin foam scrum cap, a thin foam shoulder pads, and also a mouth guard. Apart from that, you're not allowed any other protective gear. So injuries are common. Anyone who's watched the game will see how aggressive and physical the game is. And because of this and the lack of protective kit, injuries are very common. The reports would be up to 7 to 18 per 1,000 playing hours. Strains, sprains, contusions to the lower extremities are more common, obviously. The tackle, specifically being tackled, is the most common phase of play associated with injury. Here we see an example of some illegal tackles. This is too high. All tackles have to be at the level of the shoulders or below. This is what we call a spear tackle, where you pick your opponent up, tip him upside down, and then drive him into the ground as hard as you can, head first. This is obviously illegal. Here we see a small example of a spear tackle. Rather than shoving his head into the ground, he just uses his weight to impart impact on the opposition. So injuries to the cervical spine still remain high in rugby, and most of them are catastrophic in nature. The rate is decreasing, but preventable instances still occur. The scrum and the tackle are most common phases where the cervical spine is injured, particularly the engagement phase of the scrum. So we're going to look at this more closely. Some technicalities about the scrum. As we saw, the horizontal engagement force has been calculated to be up to 8.8 kilonewtons in the Australian national team. And they say that a force of up to 1.5 tons goes across the cervical spine at that time of engagement. In an effort to decrease the amount of cervical spine injuries in rugby, they introduced a law to try and make this the engagement phase more coordinated. And we see here the two teams are supposed to line up against each other. They then crouch, they then touch, they pause, and then they engage. So there's relatively low velocity of the impact, but it's the high forces that cause the injuries. And what happens is the scrum collapses, as we saw. The front row players, their forehead hits the ground, but unfortunately they then have the rest of the scrum pushing behind them, and it just causes a gradual hyperflexion of the neck, resulting in an anterior dislocation with unilateral, bilateral lock facets, depending on any rotational position during the injury. Here we see an example of a collapsed scrum. If you look more closely, you can see the position of hyperflexion there, and the danger as everybody else behind him just continues to push. This is an example of a collapsed scrum. You can see the way they try and engage carefully, but due to the amount of force being pushed behind them, it's often inevitable that it's going to collapse. So, worryingly and interestingly, in the USA, a recent review found that cervical spine injuries in the US game were higher than that found elsewhere in the world. And they postulated this was due to a mismatch of strength and skill in the games, poor training, poor coaching, the use of the head more than in the other game, just an innate reflex. Having grown up playing football, I guess that's what happens. So they suggested that they need better skills coaching, better player education, avoid mismatching of skill and strength, appropriate on-field first aid, and a national registry of injuries so they can actually monitor what's happening. These are some real non-orthopaedic injuries, but anyone associated with the game or treats rugby players should be aware of them. This is cauliflower ear, where the perichondrium is delaminated from the underlying cartilage by hematoma. The treatment is sterile aspiration and pressure bandages. It can be prevented by wearing a scrum cap. This is a front row player. These are generally caused by frictional injuries. Gouging, this was an old favourite of the French national team, where in positions where you really can't do anything else to impart pain on the opposition, you just take your fingers and put them in any orifices available, and mainly the eyes. This has largely been eradicated from the game because of television match referees. Also, something to be aware of is infections. Herpetic, viral and bacterial skin infections are very prevalent in rugby because of the abrasive nature of the sport, and these can become endemic within teams and within clinics very quickly if you're not aware of them. So the take-home points that I would like you to go away with is that rugby is a great game, and I encourage everyone to try and get involved and watch the sport. The players are a very unique patient population. Basic knowledge of the game will serve the physician well in the physician-patient relationship. Please, if you're attending the games, be attentive to the scrum and the tackle phases of play, because this is where the more serious injuries will occur, and prompt treatment is best. And be proactive in recognizing coaching insufficiencies and mismatches of strength and size if you're involved in the school system, and always be up to date with the management of acute spinal injuries on the field. Thanks very much.